Urology viewers, good evening, one and all. Today, actually, an important part related to the laser and its settings. As you all know, two laser machines are used in the present day in urological practice. That is Holmium laser. Let it be 30 watts, let it be 60 watts, let it be 100 watts, let it be 120 watts. Thulium fiber laser, 35 watts and 60 watts. Now, the speakers today have the experience with all these lasers. That's why we wanted to take opinion from them. It is more a conclusion as of now, taking their expertise in Indian clinical setup. Every time we cannot ask what is the best paper with literature support, but sometimes practical aspects, the consultants who have done hundreds and maybe thousands of cases, we wanted to do their experience. They might have seen different clinical scenarios. We will have interactive session. At the end, we will ask each person, consultant, to show their videos in clinical perspective. So today talk will be approximately 1 to 1.5 hours. Definitely, because some people will see later on, we wanted to make a good document. Since long time I was thinking. So I hope this will be very helpful for the beginners. To briefly summarize the instead of going into the minor details, I will directly introduce about the consultants. So this is the picture. I am myself Dr. V. Chandra Mohan, as I am conducting the pure urology. Most of you know me. And next speaker is, can you shift this up? This up. I'm not able to see or minimize. So Dr. Soundarya is a consultant urologist. She did from Madras Medical College. After that, she did with me fellowship, and then Preeti Urology and Kidney Hospital. She is the consultant. The one good thing about Dr. Soundarya is more scientific in her approach. She has won 3 consecutive Best Paper Award in our state. I don't want to read all these. That is the best achievement I feel she has done in the last few years. Apart from that, she delivered talk in 2021 Philippines Urology Association and published papers. Nearly 10 papers she published along with us. She has written a book chapter for USA and metabolic evaluation of the stone, and she got Best Paper Award in our state conference 2021, 22, 23. And Tanuj Bhatia, Dr. Tanuj Bhatia is very close friend of me from the New Delhi. Recently, more than 1 year now, he is with his own hospital, ILSS hospital. He is the present secretary, Haryana Urology Association. He is one of the well-known person in the field of enucleation of the prostate. Apart from that, he organized various workshops like LaserCon 2017-22, Hook Vista workshop, RIRS workshop, Luminous Art of Enucleation workshop. More important is VUST, where he demonstrates the enucleation and gives hands-on also at his center in Gurgaon, and that is a very well-known program for the enucleation of the prostate. Dr. Vikram Sridharan is from Trichy, and he is the one who practices endourology aggressively. When I have gone, I already mentioned that when I have gone there for workshop, I have seen their team doing supine PCNL in 2017, something like that. After that, I started supine PCNL, seeing them, and I developed a lot of interest. And then I also started teaching supine PCNL. They are the pioneers in supine PCNL, and they practice together, 4 of the consultants. And he is the chief instructor of True Endourology Fellowship program also now. So juniors can utilize that program. Now, Dr. Parimal Gharia is from the Surat, and he is also one of very close junior to us. And he developed interest in endourology and laparoscopy. The important part he contributed to Indian urology section is he first thought the aspiration of the fragments through the scope, that is now the direct intrascope suction or manual intrascope suction. So he done lot of work on how much powder will be sucked, how much fragments will not be sucked, whether this is good, or he used fans also, shared lot of his views on Twitter, and now he is internationally known, and many of the people who present suction in endourology will quote his picture of direct intrascope suction. Dr. Dheeraj Kasaraneni is from our area. He is from Vijayawada, and he is his own hospital is there, Prashant Hospital in Vijayawada, and is also lead consultant in Ramesh Hospitals. In a short period of time, he mastered the enucleation of the prostate, which is very difficult. Even today, I feel that I am not completely getting command on that. In our area, he became well known, and then he started demonstrating the live surgery very well. His points are lesser laser mission, like 35 watts TFL also he can use and do enucleation. He combines a little bit of mechanical as well as the laser, but very nicely he demonstrates sphincter sparing surgery. So two of the consultants today have Dheeraj and Tanuj Bhatia are for the prostate experts. They also do stone. It's not like that. Whereas myself, Soundarya, Parimal and Vikram are more into multiple aspects of the stone. So to avoid the PowerPoint presentations, I make a smooth discussion so that one by one we will take proceed. First, we will take the ureteric stone, because lot of discussion happens ureteric stone. So first I will start with Parimal. Parimal, when there is ureteric stone, there are two types of stones. One is floating stone in the ureter, which is routine we do. Another is densely impacted stone, where maximum a guide wire goes. So I want a quick answer that what is a laser you prefer? If you have Holmium and Thulium both, what do you prefer, Parimal?
I have both the lasers, 35 watt Holmium and 60 watt TFL, but for the all ureteric stones, I exclusively use Holmium laser.
What is the main reason you are saying that for that?
The main reason for Holmium is the mode of the fragmentation. I use a fragmentation mode with a very low power and low frequency. Just burst at the center, the stone fragments.
What is that low power? What is that low power, low frequency?
It's 0.6 N into 8 or 10 maximum.
0.6 into 10, so that it becomes 0.6 watts.
Yes.
6 watts.
Yes. And the stone fragments rather than dusting. Short pulse.
So you don't make powder, you make fragments and take it out.
Yes. Or I put it
do you do under spinal
ureteric
anesthesia, general anesthesia? General or spinal?
I do all general anesthesia.
You do under dust mode?
Once the stones are in the normal ureter, then once the stones are in the normal ureter or a dilated ureter, then I shift to a dusting mode and then dust the stones. Whenever there is an impacted stone, I will not use a dusting mode at that place.
Okay. Vikram, same question. In the ureter, Vikram, unmute. In the ureter, what is your preferred mission, and what is your message that what laser settings are safe?
The settings for me, basically, I have access to all the lasers, but my preference would be to use, if it is an impacted stone, I would disimpact first with lithoclast. I still feel lithoclast has a very strong role. Once I disintegrate, fragment it, and then I use dusting mode. I have a 30 watt quanta, and I use frequency of 5 and energy of 3. So I use a 15 watt once I disintegrate. If the access is difficult, if my vision goes down when I use a pneumatic lithoclast, once the probe goes in, then I still prefer using a 5-3 dusting mode, core through the center. Once the vision starts improving, then I go from center to periphery.
Okay. Now, there is a controversy here, Parimal versus Vikram. Parimal said that 0.6 joules and 10 hertz, whereas Vikram is saying 5 watts and 5 hertz. Sorry, 2.5 and 5. Is it, Vikram?
3. 5 frequency and 3 energy. So total will be
Yeah.
15
What is the
watts.
reason you are keeping so high energy? Very few people use very high energy.
So basically, I reduce the frequency. We use very low frequency, whatever is the
So that
lowermost
you
possible.
clearly hit the stone.
We clearly hit the stone. We have better control. So from the beginning, we have been using, say for example, our first generation of laser, the lowermost frequency was 3. So I used the 3 frequency. I started with the 3 frequency. Now with Quanta dusting
Very
mode, the
voice
lowermost is 5.
is continuously breaking.
Okay.
Okay. So you prefer Quanta dusting
30 watts.
3 watts and 5 hertz.
Yes. 3 joules and 5 hertz, totaling to 15 watts.
3 joules, 3 joules and this thing. Soundarya, what is your take for that? Ureteric stone, densely unmute Soundarya.
Yes, sir. So, ureteric stone, densely
Yeah.
adherent. I would start with a pneumatic.
Soundarya,
Am I audible, sir?
yeah, now you are audible.
Okay, so ureteric stone, densely impacted. I will start with a pneumatic lithotripter and disimpact the stone to a normal location. And given a choice between holmium and thulium, I would like to go with a holmium laser for a ureteric stone. I will start with 8 hertz and 0.8 joule or 10 hertz and 0.8 joule. If the distal ureter is accommodable and we can retrieve the fragments, I will aim for fragmentation. Or if the distal ureter is not good and we are left with making a powder, then I will start powdering with a lower frequency and lower energy, preferably lowest energy possible, and I will dust the stone. But in case holmium is not available and I'm in a situation that I have to use a thulium fiber laser, then I will start with the fragmentation mode of thulium fiber laser after disimpacting the stone. And my settings of thulium fiber laser for a ureteric stone, which is floating, will be 6 hertz and 1 joule or 10 hertz and 1 joule in the fragmentation mode. So in the fragmentation mode, 6 to 10 hertz and 1 joule will make powder of the ureteric stone with thulium fiber laser.
Overall, you wanted to keep your wattage less than 10.
Less than 10 watts in the fragmentation mode. Yes, sir.
Hello?
Less than 10 watts in the fragmentation mode. Yes, sir.
Okay. We will ask Dheeraj and Tanuj quick version on this.
Yes, sir.
Not that you people are not experienced. You tell your version. We go more detail with the Dheeraj, please.
We agree that the energy should be low, sir.
Dheeraj?
We agree that our energy should be low. I keep it anywhere between 6 watts and 6 and 10. If I'm using the thulium fiber laser, if in case the holmium laser is not available, the TFL also I've used in many cases. I keep the frequency at 6 and energy at 1 joule. And I always believe that it is the improper technique rather than the laser which causes the stricture. If I'm using the holmium, I put the setting at 8 hertz of frequency and 0.8 of energy, joules of energy.
Tanuj Bhatia, sir.
Sir, I prefer holmium in ureter. I don't use pneumatic much, and I prefer, so I have a high power laser, so I generally use a 0.4 to 0.8 joules, and hertz also 5 to 15 hertz, not more than that. My preference is to fire at the center of the stone, break the stone into 4 or 5 pieces and take out the stone in ureter. If it is a upper ureteric stone, I prefer to push it to the pelvis rather than even upper ureter and then fragment it there. Generally, I never dust in the ureter, sir, because dusting means a high frequency, and out of energy and frequency, it is a frequency which is more dangerous.
So at least for the audience, see, lot of the same question will be asked by many people. All of us have confirmed that either pneumatic or holmium is safer in the ureter. That is one conclusion we can keep. All of us are keeping less than 15. At least less than 10, all of us. Only Vikram is because its setting are different. And 4 out of 5 agree that, 5 out of 6 agree that low frequency, low energy, break it, if possible, take out the stone. If it is freely floating, make powder therein and there itself.
Correct.
Is it okay? Then we can conclude this way.
Yes.
That Holmium is better, pneumatic is better, low energy, low frequency is better, fragment and remove the fragments. In case very good space is there, slowly touch stone and make powder so that they will fall off and relook will not be there.
Yes.
Yes,
Now
sir.
we will
Yes.
go to the intrarenal stone, pelvic stone, which is a very easy situation. You can do errors. Some people wanted to do fast. Some people wanted to do slow. What I wanted to ask is, what is your laser setting in the beginning part of your career? What is the laser setting now? And what is the laser setting if you use fans? There are 3 stages occur. One is when you first purchase, you try to be very slow, stone will be moving. These problems will be there. Once you acquire 50, 100 cases, then you try to know where it goes and fast you chase and completely powder it. Now latest is, you don't need to powder, you make fragments, keep it in some calyx, half of broken, and take out all the fragments from fans. What are the laser settings for that? Thulium versus Holmium. Parimal, again, I'll start with you.
Yeah, I started with the Holmium laser 35 watt in initial part of practice for.
Yes, Parimal, your voice is breaking. Is there any way?
Mm.
Sir, actually,
we are
we are
getting
hearing
his
clearly.
voice. I think
Hello. Now is
I
it clear?
think connection in Hyderabad is not good.
So it's actually heavy rain outside.
You can connect to the hotspot if you can connect.
No, sir, we are getting his voice clearly, sir.
Probably your this thing has some problem, frequency. Here we are all hearing it properly.
Huh? It is a streamlining is the problem.
Must be.
Yes, sir. We are getting it clearly, sir.
Okay. I have removed my mic. Maybe that must be a.
Parimal,
Yes, sir.
in that case, I will listen from the phone so that at least I can talk well. Can I listen? Tanuj Bhatia, sir, your opinion on the renal stone RIRS, because your voice was coming better. I'll first go with you.
Sir, I generally start with 0.3 to 0.5 joules and 25 to 35 hertz. In my earlier machine, I used to prefer 25 hertz. When I go close to the stone with 25 hertz, it causes fragmentation. When I keep it a little away, it causes nice dusting. So in my 100-watt machine, that was my preferred setting. So, and most of
Can
the
you
time,
repeat, sir? Can you repeat, sir?
so there is a double echo happening somehow.
Yeah. So I am not able to listen from here. Is there any other Wi-Fi we have connection here?
So, sir,
Separate, that is?
uh,
No, which is better? Oh, I have also put a major connection, but I am not listening properly so that to conduct well. Tanuj, sir, can you speak now?
yes, sir. So we have to understand the settings are different in Holmium also with a high power and a low power machine. High
Okay.
power machine, we go for very less energy and high frequency, because the advantage in a high power machine is that we can get good frequency. So I generally I start with 0.3 to 0.5 joules and a frequency of, I start with 35 hertz. And then at the end, I might go even up to 50 hertz when I want to do that pop dusting. Compared to this, when I'm using a low power machine, most of us would use 0.8.
My question is very clear, sir. Renal stone present in the pelvis.
Yes, sir.
From beginning, you wanted to do dust.
Yes, sir. So
with high frequency, low energy.
Exactly. So that is why 0.3 and 35 or 45 hertz, I would start.
0.3 is too low energy, sir.
With high power machine, it works very well, sir. Very well. You get very fine dust.
So, okay, Vikram, what do you say?
I have a very standard setting. It's frequency 5 and energy 3. Ureter, renal pelvis, calyx.
Ureter also same?
It's all same.
So it is totally coming opposite between Tanuj Bhatia, sir, and this thing. He is using 20 hertz and 0.3, 20 hertz and 0.3 joules. You are telling 3 joules and 5 hertz.
No, sir. We have to understand the settings are different between a high power and low power machine.
Sir, even high power laser setting, low power laser setting, the delivery, when you talk about wattage, for example, you told 30 hertz and 0.3, that means you are delivering only 9 wattage, 9 wattage.
Yes,
Whereas
sir.
Vikram is delivering 15 wattage. But
Yes.
the mode of delivery of the energy is totally opposite. One
Yes.
is choosing high frequency, low energy. Another is choosing the
Low frequency, high energy.
low frequency, high energy. Now, Parimal, I was not able to listen, please.
Yeah. For earlier, I was using a holmium laser, which did not allow me to go below the 0.5 hertz joule. Now I have a machine that allows me to go to 0.2, 0.3, but I am not satisfied with 0.2 or 0.3. I started with 0.5 and the frequency of 15. So that is for holmium, the settings were 0.5 into 15.
This we did not
1.5.
know. We were using 110 as standard, like Vikram told, 10 hertz 1. Now I am using 110, you both are using 0.3 and 20-30 hertz. Now, Dheeraj, your opinion.
Sir, last 5 years I've been using TFL laser only. My standard setting would be 33 frequency and 0.3 joules of energy. That's my standard.
So third person again using high frequency and low energy. Soundarya, I think you will be same like me if whatever you say. Yeah.
So for a pelvic stone, to aim dust in the fragmentation mode, we start with 10 hertz and 1 joule if it is a calcium oxalate dihydrate stone. Whereas if it is a hard stone like calcium oxalate monohydrate, we go for, and a large volume stone, we go for 15 hertz and 1 joule in the fragmentation mode to get a dust.
So for dusting RIRS pelvic stone, majority opinions say that high hertz and low energy completely dust.
Yes.
This is what. But Vikram has a personal experience saying that he is adapted to 3 joules and a very low frequency. So for the audience, this clearly shows that each person has his own preference, his own mission. As Tanuj sir saying that mission output is also different. Kindly remember this. Even TFL 3065, as Tanuj sir says, 30 watts Holmium versus 100 watts Holmium, maybe output may be more. 100% it is correct. Every machine is different. So for gross purpose, please, there is no need to cross 10 joules. So we agree that 35 watts is enough. You adjust at around 15 to 20 frequency and low energy less than 0.5 is at the moment take opinion. But you can try what Vikram says. That is up to you. But that means it can be tried. Yes,
so I also have.
I was talking about the holmium laser. Now with the TFL, the settings has been totally different.
Tell me.
The settings are now standard is 0.6 into 20. Earlier was a 0.6.
Overall, you are using low energy, high frequency for dusting.
Yes, sir. Yes, sir.
That is concluded. Either 0.3, 0.6 is okay, but 20 hertz and 0.3, 0.6, Soundarya, you have to note it. We will try with this because we will take it at the same time.
Dr. Dheeraj is also using in dusting mode, I think, sir, not in the fragmentation mode.
That's what I'm telling. We are using fragmentation. The ultimate purpose is all of us are very seniors, and in the sense, I've done more than 500 cases at least. That means literature is not the only thing. Personal experience, see, people are telling that 20 hertz 0.5 is majority of the people telling in the dusting mode. Whereas we are doing fragmentation mode 110 we enjoyed. Whereas Vikram says, I enjoyed with 3 watts and 5 hertz. That is 15 watts only. 15 watts is not very high. It is except it's like a pneumatic lithotripter setting is using. 3 watts is like pneumatic lithotripter, where frequency is less, intermittent pneumatic lithotripter type.
Sir, I have a few points to note.
Yes.
For the benefit of viewers. Every company has a different sweet spot. Like my setting in Quanta 30 watt, and all my teammates here have, each one of them have a Quanta 30 watt, same mission. But the setting is not the same sweet spot in every mission. Say, for example, in my hospital, when I use a frequency of 5 and energy of 3, whatever output I get, in my friend's hospital, with a frequency of 5 and energy of 2, I get the same output. I get the same effect. It's the same mission. It's the same Quanta 30 watt.
Yeah, that I am mentioning. But the only thing I am saying is, you are the only person who are using at high energy, low frequency. Whereas other people are using That is the conclusion. Who is correct, who is not, we are not discussing.
Yeah, yeah.
This is not a debate or anything. It is the opinion of 6 people. So that lot of people will be asking, sir, what laser? If they listen to that, they can set whatever the settings they want with their mission. Now, third question. If the stone is in the calyx, upper calyx or lower calyx or middle calyx, you wanted to do it more than 1 centimeter stone. Do you apply same powder technique in the normal RIRS or you do popcorn technique with a different setting? I hope the question is very clear. Let's start with Parimal again. Caliceal stone, accessible Caliceal stone.
All accessible stones in the renal pelvis or all Calices are done with the TFL with the 0.6 into 20 hertz setting.
Same.
Only when there is a later part of the stone where there are multiple small fragments and I wanted to do a pop dusting like thing. At that time, I switch it to 0.2 into 100. And that is intermittent short only. It should not be continued short burst and then stop and again started.
So, correct. So, very high frequency, low energy produces heat. He says that heat should not damage. It is for short period to make the finer fragments into the powder. I also use same. The first one he said is same setting as in pelvis. That is 0.6 and 20. 0.6 and 20. Whereas popcorn he says 0.2 and 200.
100.
0.2 and 100. Total 20 watt. This is the highest wattage you are using. That is recommended also it was. Now Dheeraj, in the Caliceal stone, what is your setting? I mean accessible Caliceal stone.
I start off with my routine setting, sir. That is 33 frequency and 0.3 of joules of energy. And
this is with TFL. Which company you are using?
I'm using IPG Uralace.
IPG. I am also using IPG. I have never used this setting. I will also try. So your primary is low energy, high frequency as much as possible.
Yes, sir. And also if the stone
in a dusting mode, mode is dusting.
Mode is dusting, sir.
So 0.3 into 30 hertz.
Yes.
Now Vikram, please. Caliceal.
Holmium is the same, 5 and 3. And
5
TFL,
and 3.
Yeah, TFL IPG 30 watt. I use 7.5 hertz and 0.8 joule.
7.5 hertz and 0.8. So you have come back to our type of setting.
In TFL, I am little afraid about the heat production. So in TFL, I reduce everything. I fix it at 6 watts. Maximum I'll go is a frequency of 10 with a 0.8 joule.
Sir,
okay, that means okay, sir. Please, Tanuj Bhatia, sir.
Sir, when you talk about fragmentation versus dusting mode in TFL, from what I am understanding correctly, the only difference is that in dusting mode, the pulse width is longer and in fragmentation, it is shorter.
Yes.
That's the only difference, sir?
Yes, of course. Yes. Yeah. The thing is, when you say that, Tanuj sir, the fragmentation mode has more chances of retropulsion, more chances of pushing the stone, more chances of giving at a shorter pulse to the stone. Yes, so it tries to break the stone. But we adopted fragmentation mode 1 joule and 10 hertz, where nice dusting happen. But all of you have adopted different techniques. All of you cases night dusting happening. So that's why I know that your laser settings, most of it. That's why specifically I have chosen you people. I know all of the laser settings because I am interacting with you people for 10 years.
Yes.
So Tanuj sir, what is your setting in Calyx? Same? Like
similar, sir. I would
always
30 hertz and
30 hertz and
yes, sir. In Caliceal, even if it moves a little bit, it's okay. So I don't mind short pulse width.
Soundarya, you go like Parimal similarly?
In the fragmentation mode for a Caliceal stone, 10 hertz and 2 joules for breaking the stone initially. And then once the stone is fragmented, to popcorn it, 100 hertz and 0.2 joule. In the presence of fans, we do not make the stone powder till the end. We make as many small fragments as possible, and the laser time for popcorning is also reduced because in the presence of fans sheath, most of the fragments are sucked out. So the setting for popcorn will be 100 hertz and 0.2 joule, and the fragmentation 10 hertz and 2 joules.
So we are using 10-2 or 10-1 for the fragmentation mode. And nowadays, particularly if it is post-entered and a fan sheath goes, it's okay. Even if it doesn't go, what Soundarya is saying is that if it is calyx, it cannot go out. It cannot go out. So fastly fragment, fastly popcorn, but intermittently, I mean to say. There is no need to continuously hold tightly and do powder like in pelvis. So again, same question will be asked to four of you. Caliceal stone, what is wrong if you do fragmentation and then popcorn, especially with TFL? Parimal.
So what I feel is once you make a multiple fragments, and if you don't have a fan sheath in situ, it will take time to make it a dust that is acceptable to me. So my goal with or without fans is always a dusting. Even with the fans, I continue with the same settings and aspirate the dust continuously till the process when there are 20% stone is remaining, which itself fragments into a small fragments. And that is by sucked out by the fans. So the fans, maybe suction is going on, but it is suctioning the dust. So the vision is continuously, a good vision is there, and I do suction continuously.
For that, that means pelvis and caliceal stone, you don't change the setting. You don't try to use popcorn more. You try to dust as much as possible with your standard setting of 0.6 and 10.
20.
0.6 and 20.
Just I want to add one thing is it is in an expert mode. In a TFL 60 watt machine, there are expert mode where you can play with the pulse width. So in that case, 0.6, 20 and the short pulse width. In that case, in expert mode, you can change the pulse width. So I keep it is a short pulse width.
Tanuj Bhatia, sir, do you change the pulse width honestly in your machine when you are doing the stone, or you don't do it with the Gina laser machine which you are using?
Luckily, sir, most of the newer machines have two pedals. You can have two settings. So I keep one setting with the long pulse width and one with a short pulse width. I prefer the longer pulse width for dusting and the shorter one for fragmentation or popcorning towards the end.
In the sense, you don't change the settings of the frequency and joules also.
Just two settings and we finish it with that.
So you always more or less fixed with your 30 frequency and 0.3?
Yes, sir. Sometimes in fragmentation, I use 1 joule in kidney. This is. So there I use 1 joule and 10 hertz also sometimes to fragment. But I never.
Okay. So now we'll go to the next question.
Sure.
Yeah. So next question is inferior.
Your voice is breaking.
Yes, sir. Tanuj, sir.
So fans I've used in one case only recently. Somehow I don't find that friendly ureters for primary.
Okay.
One case recently I had a good primary.
Next question I wanted to ask you. Yeah. Next question is inferior caliceal stone, not completely accessible with flexible scope. You are seeing part of the stone, you have difficulty, you cannot play on the stone very well. So, Parimal.
In that case, the fragmentation mode will be helpful. If it is available in the same OR, I will switch over to Holmium laser from TFL.
Fragmentation mode?
Fragmentation mode. I will switch over to Holmium laser and do a popcorning like thing, 1 into 10 hertz, 1 joule and 10 hertz. In that case, stone will be moving into the calyx and it will come into the picture, and it will, if it will have a popcorning effect, and it will come out of the calyx.
So you use a little high energy to make the fragments in that case?
Yes, sir. Yes, sir. Because I do not have an
access
to stone.
Sir, if I have a difficult access, I have very less time in contact with stone. I increase my setting from 33 hertz to 38 or even 50 hertz maybe. And I also increase the energy from 0.3 to 0.4 or 0.5. So by increasing the energy and frequency, I try to break them into larger fragments. When I get access, I continue with the pop dusting mode, which we have in the TFL. So rather than fragmentation, I'm more.
Yeah, got the point. So ultimately, aim is to somehow make the fragments, somehow make the high frequency reach the stone to your level and get out of it instead of bending the scope for a long time. Even if they come out into pelvis, okay. Even if you take out with a basket, okay. Your aim is to make high frequency, high energy you are using, Dheeraj?
Yes, sir. Yes, sir. Energy also 0.4 and 0.5 I use, sir.
So we want the
But
stone.
you are not going up to 1.
No,
Yes,
not.
sir. Tanuj, sir.
We
What
want the
is your
stone
what is your
the
take?
stone is not very clearly visible. We want the stone to jump out of its place, come somewhere in our vision so that we can do the popcorning and finish it off or to transfer it.
Correct.
Now,
So
incidentally,
this is
today
the
morning,
most difficult situation.
yes, sir.
Uh,
Incidentally,
all
today,
of you are telling Vikram, your settings are same. There also that 3.
Mine is universal, same. Except bladder stone, everywhere else I use the same setting. Tanuj was about to say something.
3. Yeah, Tanuj, sir.
I use, sir, 1 joule and 10 hertz generally, or 8 to 10 hertz, because I want more energy. I want it to jump out. Even if it is 4 large fragments, then I would pick them up, take it to a better calyx and do it. Incidentally, today morning I was doing a pelvic kidney lower caliceal stone and I had only TFL. And the same setting worked there itself, because I was wishing I had my Holmium laser. I did not have it. I had TFL. I used the same setting of 1 and 10 and I could do the job in fragmentation mode.
Soundarya, inferior stone, non-accessible. How do you take?
So make into fragments as early as possible with whatever part of the stone that is visible. So I use 2 joules energy and 10 hertz, make it into bigger fragments. In case if it is not basketable and we are forced to do popcorning in that place only, I switch to popcorn as early as possible, 100 hertz and 0.2 joules, and make the fragments jump out and reach the scope and finish it off fast.
Okay. One question has been asked for the Holmium people. 200 micron fiber in stone. What is the maximum energy, Tanuj sir, you have used without damaging the laser fiber? We don't want to use the maximum. What is the highest you have used, at least please tell, sir.
So again, that also varies a lot with the machine that you are using. My earlier luminous machine was not allowing me to use little higher energy, but my current machine allows me to go to any level. So it is not restricting it anymore. Still, we try to be under 20 watts when we are in the kidney, be it anywhere. So that's how it is. The earlier machines were restricting. Now the newer machines are not restricting the energy even through a 200 micron fiber, at least in the machine that I am using.
Okay, sir. Now we will go for tough cases. 3 tough cases. I'm feeling that where tough case is there. Parimal, a stone which is present in a diverticulum which is large, which is a secondary stone, you are not able to focus on it. Every time it is moving, whether you are doing RIRS or PCNL. Yesterday only I had problem. Hard stone, round, smooth stone. How do you tackle?
In that case, the energy should be increased and the frequency should be decreased. So in a TFL, I goes to 1, it can fragmentation mode, 1 energy and 10 to 15 hertz. So in that cases, some beam will focus on the stone and that will make some small breaks, and that will be utilized for a pop. Then later on, some fragments are there, then you can switch over to a pop.
Till now you are telling that 0.6, 0.6, 0.6. You will use 1 joule only in conditions where you wanted to break it desperately.
Yes, but the round stone which are not
able to fix it.
Not stable, unstable stones moving around. In that cases, you are not able to focus that. In dusting is very difficult in those cases. In those cases, you have to use a more energy and high power.
Dheeraj, please.
Same thing, sir. I try to increase the energy. Normally, I'm comfortable at 0.3 and I take it up to 0.6 or 0.8 and I bring down the frequency. That's what I do. All in dusting.
You are using the lowest energy among all 0.3 TFL 0.3 you are using.
33
and that we have to see in dusting mode you are using that.
Yes.
Okay, Vikram, how do you tackle secondary stone? Same setting?
Same setting.
Very nice.
The best part that I feel with this setting is it doesn't, I can, as Tanuj was saying, it's more of the technique rather than the setting. I can use it for breaking. I can use it for dusting. Most of the time, I don't use popcorning at all.
Okay. Okay. That's also we wanted to know. Lot of people are not recommending popcorn a safe method. Parimal said intermittently you use. Soundarya said quickly you go it. Tanuj Bhatia saying that high energy laser I use rarely. Dheeraj is also saying I is using dusting mode in fact. I used a little more, but I observed that outflow will be very hot. Outflow will be very hot if you use continuously for more than 1 minute. Sir, Tanuj sir, secondary small stones, even in bladder when you do enucleation, when they are floating too much, how do you manage them, sir?
Sir, in RARS, it's the most frustrating type of
Yeah,
RARS.
I understand.
Grossly dilated systems and multiple stones in a calyx. It's a very this one. So if there is one stone, slippery stone, as everyone has mentioned, high energy, low frequency. Focus on the stone, drill into it, make it into 2 pieces, then make those 2 pieces into 4 pieces. Then you can do whatever you want. You want popcorn or you want to take it out, you can do it. If there are multiple stones, no
Very
option, just
difficult.
keep it in the middle. Sir?
Very difficult, no, sir.
Very difficult.
They slip here and there, the frustrating volume will be same. PCNL is ideal. Just suck out everything or fan sheath. That is where fans will be definitely
That
useful.
is where fans would be very, I would be a fan
Very,
of
very
fans
useful.
for the
Certain
cases.
cases where fans is very useful. Soundarya, what is your setting in case of round, small stone which is moving away?
So for very hard stones, it is better not to increase the energy beyond 2 joules or not to use 2 joules energy. We restrict to 1 to 1.5 joules, 10 to 15 hertz, so that the sparks or charring carbonization type effect does not happen, and it better helps to break the stone. So 10 to 15 hertz, 1 to 1.5 joule in the fragmentation mode to break the stones early and then switch to popcorn mode.
Popcorn mode. Okay. Now, next clinical scenario, difficult clinical scenario. Patients who come with a small stone wants 100% clearance, 3 stones in 3 calyces, each 6 mm only, but he want to go for pilot job. Naturally, that is a time when your clinical skills are questioned the maximum. Because next day, if they get ultrasound, there should not be any stone except papilla, some rough patches on the papilla, nothing should be seen. So, Parimal, how do you proceed with that?
In that case,
3 stones, 6 mm.
In that case, just fragment into a 1 or 2 fragments with a very low frequency, and then take it out with the basket.
So low energy, low frequency. What is your setting that?
In that case, 0.3 20 or a 0.6 10 is also okay.
In dusting mode?
No, sir. All this is in the export mode with the short pulse in a TFL.
This is intercardio or TFL?
Intercardiac IPG machine. When there are 3.
Where is the export mode? Is it only given to Parimal or it's for us also?
No, sir. There are 3. There are 3 settings. One is a stone. Then another is an incision mode, and third is an export mode.
What is that export mode? Soundarya, are you aware?
Yes, sir. Yes, sir. Expert mode is there. There we can switch and we can manipulate our own settings. Yesterday, our machine also we have done that.
So, Parimal, what is that export mode setting you use?
The expert mode is just you can play with the.
What is your play on these small stones? 0.6 and 10.
10. 0.6 in the 10.
And 2-3 pieces and take out with basket.
Basket, yes, sir.
Dheeraj?
Sir, my energy will be the same, 0.3, and I reduce the frequency to 20. So I try to make it into very fine dust, and hopefully it gets.
So you try to dust. That's risky because during dusting process of 3 stones, even if you miss one, if it is 1 or 2 mm, government will reject, and patient also will have a discussion with you. That is a tricky part. Anyway, it is your setting, dusting mode, 0.3 and 10.
Reduce the frequency so that we have better control over the stone. So that's
0.3 and 10, dusting and 0.3 and 10.
0.3 and 20.
Vikram, same setting you are telling?
Frequency 5, I reduce the energy in this case. I will put it at 1. So I use
that is
only
correct.
5 watt.
Correct.
And then I have better control.
That is 1 and 5 hertz is a very good control, I also feel. But acceptable. Tanuj sir, high watt laser you have. You are more risky to make it go here and there or fragment pieces.
High watt laser allows you more play in settings.
Yeah, what lower settings also you can play?
Yes, sir. You can make 0.4 or 0.6 joules and 10 hertz and make it into 4 pieces and take out. One thing I would like to emphasize here is because I burnt my hands, never guarantee that person that you're going to take out.
Yeah, that is okay. That is okay. Now I also burnt. That is totally different. But the patients actually, honestly speaking, those who get stoned, they should not be allowed to go into the pilot driving. They will be recurrent. Why should we remove and give the certificate? That's a totally different issue.
Yeah,
But anyway,
because a lot of juniors will be there and these cases come in the beginning, so they come a lot.
yeah. I have a feeling that if you hold it, take it out completely, like PCNL, a single stone out, nothing like it, because 100% it will come out. 6 mm stone sometimes come out of the access sheath with rotation. Our judgment will be it is big, but it will come out somehow. Soundarya, what is your setting for small stone, 3 stones in 3 different calyces?
10 Hz, 1 joule in the fragmentation mode. Make it into the smaller fragment, and once it is done, basket out or use a fan's access sheath.
Yeah. So if the stented and fans is there, now the things have changed. Now, last question regarding to the stone. Last 2 questions. Large volume staghorn, we should not do RIRS. But people are doing staghorn means not completely stag. A big stone of 3 centimeter. I am seeing in Facebook that every day one person is keeping. I have done 3 centimeter stone. That means they are doing it. If it is not doable, even juniors after 1 year, they are doing it and saying complete picture of disappearance on the CM. Maybe fragments may be there. Now, time is the concern. Outflow is the concern. Imagine fans is not there. You have all the lasers with you. Now, how you post-tented think that ureter is accommodable? We are thinking that ureter is not giving trouble. Parimal, what is your setting for large volume stone to quickly finish it?
For large volume settings is same 0.6, 20.
0.6 stones and 20 make as much as powder, as much as powder, as much as powder.
And then last part, pop dusting. That's all.
So somewhere stones are there in calyx, you do pop dusting in a limited fashion.
Yes. Yes.
So your primary principles of dusting will not change, even if it takes 2 stages also.
No issue.
No issue. Very good. Dheeraj?
The same thing, sir. If it is a calcium oxalate dihydrate stone or a uric acid stone, 33 and 0.3. If it is a monohydrate stone, I'll increase it to 38 and 0.4. And I'll try
always in 30s. We are all not in 30. You want to stay at 30 only.
I'm very comfortable using it, sir. It's
I mean, your age also, do you want to keep at 30? 30, 30,
even
33.
prostate I use 30.
So 30, 33. Yeah. Your prostate is making your choices in the this thing also. Vikram?
Sir, when dealing with large volume stones, I would first use a semi-rigid scope and break as much as possible.
This is not Vikram. Why like that?
I'll tell you, sir. Because by using a semi-rigid, I'll use irrigation. I'll use very less irrigation, and urine will become irrigation.
I know that.
As I keep breaking with my 5-3 dusting mode, my outlet will be open. Constantly, the dust will be washed out.
Okay.
Once the stone volume comes down, maybe 2 hours, 2.5 hours, I have done that. Once the volume comes down, or when there are small parts in the inside the calyx, then I use the flexi in the end. Even an unstented system with 4.5 French ureteroscope, we are able to finish large volume stones.
Provided you go into the pelvis easily and see the stone clearly.
Yes.
But Vikram sir, that means we are doing TFL dusting without irrigation.
Holmium. My TFL is I use only when I travel. Only if I am forced to travel outside and do it.
Finished.
It's Quanta 30 watt. I'll blindly use that because we have been using for 15 years now.
Yeah. Holmium is very good. I have used Quanta. It is very good. But various reasons I am enjoying thulium fiber laser also. Enucleation, that's a different issue. Let's not go into that. Tanuj sir, what is your large stone volume? You might have done it. Definitely, I'm sure. How do you proceed?
I increase the energy slightly, sir. Instead of dusting, we get is a little bit of chipping. And all those chips or relatively larger fragments, they go into the upper calyces. We keep the head down. And then in the end, we go on doing some pop dusting and we finish the case.
So you utilize pop dusting at the end. Predominantly, all of you are saying that please don't change the logistics, make nice powder, only fragments you do it, stage it, no problem. But grossly settings will not be increased. The energy is not increased. You are not in hurry to do anything in the pelvis because the stone is big. Yeah, Soundarya, your point.
I use 15 hertz and 1 joule, slightly higher frequency to enable faster dusting.
Yeah.
Because it's a large volume stone, it's not going to fragment with this setting, 15 hertz and 1 joule. And then I ensure a proper outflow. And in case, if we want, we can stage also. In case if it is about to finish, then we switch to the popcorn mode, 100 hertz and 0.2 joule or 0.1 to 0.2 joule.
Correct. So
Soundarya, this is TFL, is it?
Yeah,
TFL.
TFL, TFL. All
TFL
Soundarya settings
fragmentation
are
mode.
TFL, and all Vikram settings are Holmium. All Dheeraj settings are TFL. Tanuj Bhatia setting is high wattage Holmium. Parimal Gharia has both access. I have both experience. The Soundarya predominantly experienced with the TFL, even though in the earlier part she used Holmium. But I used Holmium 10 years and 5 years now thulium fiber laser. So I can also comment on that. Now coming to the infundibulum stone, diverticular stone with this going slowly into the soft tissue. If you have a narrow Caliceal stone is seen through that. We are two settings now. You wanted to make some opening and then go into the stone. Both settings I want. How do you cut it and go inside? How do you make the stone clear in that diverticulum? Parimal.
Sir, for Holmium, for a diverticular incision, it is 1
Yeah.
joule and 10 hertz. For TFL, it's also it is 1 joule and 10 hertz incision mode. I cut the infundibular or a diverticular neck and then go to the stone. And once the stone is visible, then again go to a typical stone setting of 0.6 into 20.
Which laser is comfortable in these both conditions?
TFL is more comfortable for
I also say TFL is very comfortable because bleeding from
the small bleeder can be coagulated at the same time.
Yeah.
If it
Usually with TFL, when you cut, bleeding hota hi nahi hai because it coagulates per se. So
Yes.
that advantage maximum you can take in this case. Dheeraj, you are incision specialist.
Same thing, sir. I prefer TFL over Holmium. I use 6 frequency and 1 watt of energy. And if I'm very comfortable, I go till 10 also frequency.
This is for incision.
Yes, incision and stone.
After that stone also same. After original setting 33 and 0.3.
Original setting which I'm comfortable with the stone.
So for incision you are using, again repeat please.
6 frequency and 1 joule of energy.
6 frequency, 1 joule. Vikram, incision, what is your?
5.3.
5.3.
Holmium.
Very good. Holmium. Tanuj sir?
So for me, it is 0.6 to 0.8 joules and 35 hertz. So my frequency increases because I have to cut something. Energy, I still keep it low so that I can do some coagulation even if there is a bleeder. So
let us discuss about this. This is very important point. We are all saying that 110 or 0.6 10 hertz, we are nicely cutting it. Tanuj has maximum experience in Holmium high wattage. He is the one person who is saying that if I have to use Holmium, I will increase the frequency and decrease the energy. Lot of the people in Holmium, when they do hemostasis, they use this setting, na sir?
Oh, correct, sir. But I'm not using 50 hertz, which I use for my usual incisions. So it is a little lesser energy. It is somewhere in between for both the things.
In prostate, in prostate, what will you use? Because it is relevant,
50,
I am asking
50
now.
hertz. 50 hertz.
50 hertz. So you use 50 hertz and energy?
Energy in prostate is generally 1.75 joules for me.
So, and you want to cut faster, you want high frequency, you mean to say?
Yes, sir.
For
Vikram, any cutting, any incision.
Any cutting, you want high frequency. Vikram,
yes,
still
sir.
You are in the opposite side. You can cut nicely with 5 hertz also?
Very nicely, yes.
Very nicely. Dheeraj, what is your experience with thulium fiber laser as far as prostate fibrous tissue, whatever incision? Do you think that high frequency, because this is a subject I don't know. I know only 110. I want to know frequency role in incising the tissues.
Sir, it depends upon what kind of technique you are going to use, whether you are going in the right plane or whether you are going to the prostate.
No. In the not right plane, it's a tissue. For example, bladder neck on either side is not a plane. You have to incise. Diverticulum is not a plane. You have to incise. This is not a capsular plane, I am telling. We are incising a new plane.
Yes, sir. If we look at where I use my laser energy, the maximum it will be near the sphincter saving technique, where I give near the anterior 11 to 1 o'clock region, or like you mentioned, near the bladder neck where I use my incision, that will be only 35 watts. I don't need more energy. I'm talking about if you want to buy a 35 watt laser or a 60 watt laser, which is a big debate. For me, 35 watts is very comfortable because I'm in the right place.
What are the settings? What are the settings in that for incision?
Settings would be 35 frequency and 1 joule of energy.
So two experienced personnel soft tissue are telling that high frequency is needed for the incision of the tissue. So we have to take this and try. Okay, Vikram is experienced in one setting because he's yes, Vikram.
For bladder neck incisions, I use a frequency of 15 to 18, sir. An energy of 1. If it is for diverticulum, if it is anything inside the kidney, my feeling is that when I use the lowermost frequency, I have better control.
Okay.
So in bladder neck, I prefer using 15 to 18 frequency in energy 1.
Soundarya, what is your experience? You are more experienced than me in this.
Incision mode, 10 hertz and 1 joule for a diverticular incision or a posturethral valve fulguration. Use incision mode, 10 hertz and 1 joule. Once we enter into the diverticulum, then to fragment the stone, 15 hertz and 1 joule, and then switch to pop dusting, 100 hertz and
if it is bladder neck incision or thicker tissue incision?
Same 10 hertz and 1 joule, incision mode, soft tissue settings.
So, Vikram, should I tell our settings are 110, 110, 110. We are 99% 110 group. 1 joule, 10 hertz. For stone dusting, it is useful. For incision, that is useful. Only popcorn setting is different. Rest all. Do you agree, Soundarya?
Yes, sir.
I think that.
I think in my case, it differs. I think it is similar to what Dr. Vikram said. It depends on the thickness of the tissue. It depends on the control that you want at that particular point. For example, in a prostate, we are just continuously going all around. So we can have very high energy and go, once we are in the right plane, we can go about. But when we are making those pinpoint incisions, we want more control. Secondly, when the tissue is not very thick, like a ureterocele or a stenosis infundibulum, and we want very controlled, slowly the depth should increase. Then these kind of settings I prefer, wherein my energy is also not very high, but it is higher. And my frequency is also not very high, but it is higher, somewhere in between.
So in a routine case where a large prostate, you wanted to go very fast, you can go high energy, high frequency because you are experienced. But when you are dealing with a ureterocele, when you are dealing with the infundibulum, when you are dealing with any finer tissues like the thulium, the posturethral wall, everybody agrees that slightly keep low frequency and the energy, whatever, when compared to prostate, it's slightly lower energy to have better control. So ultimately, frequency is like a little bit of loss of control, Oliver Traxler sir says. Vikram strongly believes that. We also believe that frequency is sometimes loss of control of the steering. Unnecessarily, if you use it, you may lose vision, you may produce a high temperature. So let us go to the soft tissue. Now we have already discussed 40 minutes. Soft tissue, quickly go into three areas. One is bladder tumor, another is the prostate, another is the stricture if somebody is doing, and next is same like bladder neck incision or any fibrous tissues incision. Parimal, do you do enucleation with any laser you tried?
Sir, I have tried enucleations, but I should not comment on that part.
Okay. At least for bladder neck incision, do you use thulium fiber laser? It is very good.
Yes, I use a TFL for a bladder neck incision.
Any remembrance on that? What is the setting?
1 joule and 10 to 15 hertz.
Yeah, we use that same thing. Dheeraj, your settings for the prostate in two reasons. One is incision in the beginning, wherever the mucosa, which already you have discussed. Second thing is 35 watts you are favoring. And with that, for enucleation of a medium gland, what is your laser setting for the cutting, proceeding with the enucleation, not hemostasis?
Sir, my setting would be only one setting, sir. Be it incision, be it hemostasis, whatever it is, my setting will be only
okay.
That is 35 hertz and one joule of energy. That's it. No change in the setting whatsoever.
35 and see, till now you are saying that 0.3 and 30, 0.3 and 30 for stone. Now suddenly in the soft tissue mode, TFL, you came to 1 and 30, so that your total energy to do the prostate surgery is 30 watts.
35, sir. 35 and 1. 35 frequency and
35 maximum you will use.
maximum.
People say you should not use the maximum part of the laser mission. Do you have any problem or no problem like that?
As you know, along with you, I've got the machine. So since the last 6 years I've been using, not a problem till now.
Not a problem. I'm using, but 1 or 2, 5 watts I will use less. Somehow I feel that machine may get a problem. Vikram, prostate are you doing?
Yes, sir. We have
You are doing with
35 watt.
a small nephroscope, no?
Yeah.
Yeah.
We have the 22 French and the 18.5 French.
Yeah.
I use a 135 watt IPG TFL laser for prostate. 135 watts.
IPG?
IPG has 3 missions.
Okay.
One mission is a 30-35 watt for stone.
Yes.
Another mission is a 60 watt where we can do prostate as well as stone. Third mission is a 135 watt purely for prostate. We can't do stone with that.
Is
It's
it
not a
thulium or
super
thulium
pulse
fiber
laser.
laser?
It is a thulium fiber laser.
But you can use for only thulium.
Only, yeah. It's not a super
But it
pulse
has
laser.
come recently. Previously also you have done, na?
No, it is there ever since they introduced. All the 3 missions are there. They never marketed it because nobody preferred one mission for
What is
one
the
purpose.
cost of it? What is the cost of it?
It was somewhere around 55.
Okay, right. Now, what is the, if you tell that setting also no use for public because you are the only person in India maybe having that.
There were 4 installations. Mine was 4th one.
What is the setting in that?
For enucleation, I use a frequency of 40 and energy of 1.5 joule.
More or
I
less
use a
same.
60 watt.
More or less same. What Dheeraj told.
For vaporization, I use energy totally 135 watts I use. The maximum I use. So it is 120 watts of vaporization and 15 watts for hemostasis.
Vaporization, what is the setting?
120 watts. When the setting happens for vaporization, we only control 2 settings. It's not the energy that we decide. It's like 120 watts fully will be used. It's a continuous wave. It's not a pulsed laser that time. When
I agree.
It is almost like thulium YAG. So that in that
it's almost like thulium YAG, yes.
Yeah. Tanuj sir, now your expert is here. Speak slowly. I want 2 missions because you have experience with the luminous, which is so-called gold standard for years. Whatever may be the reason, you agree that. Now Gina has come and other laser missions are coming. They are competing like Quanta also has come. What is your routine setting for the prostate frequency and joules?
Sir, I will tell you 3 settings. First setting, which I was using with my luminous laser earlier. It was a very sturdy laser. I was using 1.2 joules and 50 hertz. Comes to 60 watts. All these years, for 9 years, most of my cases I did with the same setting without any problem.
2 joules?
1.2 joules and 50 hertz. Total of 60 watts.
1.2 joules and 50 hertz. This is which mission? Which mission?
Luminous.
1.2 joules and 50 hertz. Okay, sir. Now, mission, what you first setting?
So that is why every machine is different. With this machine, I was not very comfortable at this setting.
Okay.
So I saw the good output at 1.5 or 1.75 joules and 50 hertz. So I was using that setting. Then now my most preferred setting is what is called as EPS setting, wherein I use 3.5 joules and 40 hertz.
Like here you are going close to Vikram. 3.5 joules and 30 hertz.
40 hertz, sir. 40 hertz.
This will come with 100 watts only, na?
150 watts.
It won't come in 100 watts also?
No, sir. Only with 150 watts, sir.
Oh my God.
The advantage is that, see, the mechanism of dissection is because of a bubble that is formed.
Bubbles.
The bubble bursts. So when you use a high wattage, a bigger bubble is formed and the dissection area is much more.
Yes.
So more amount of tissue is dissected off the capsule. That is why the enucleation at this setting becomes much faster.
Okay.
But for some, it's very fast. It's really very fast.
So your range is 1.5 to 3, more or less 40 to 50 your hertz.
Sir, as of today, I am using 90% of cases 3.5 joules 40 hertz EPS setting.
Now.
For 1 year now.
Yes. Even for medium gland, large gland, everything.
Every gland, sir, because it saves time. And in HOLEP, I'm most worried about.
Soundarya, what is your experience? We have limited experience in our unit. I agree with that. But still, you have seen a lot of enucleations. You have also done few. So, what is your enucleation setting? Enucleation.
Incision mode 26.7 hertz and 1.5 joules. With
1.5
1.5
and
joules,
26.7 hertz. So everybody is using around 30 hertz to 50 hertz, 1 to 1.5. I mean, for the audience also, we should not confuse. At the end, there should be some conclusion that 1 to 1.5 joules and 30 to 50 hertz will do the job for prostate, whether it is thulium or whether it is holmium. That is good, at least that at this level, everybody has uniform settings. That is very good. Now coming to the hemostasis, last two parts we will discuss. Parimal, anywhere hemostasis, because en bloc resection of bladder tumor is also my favorite topic. So that and hemostasis we will take. After that, if few questions are there, that also we will take. Then we will probably stop. Next time we will take the videos because it will be too much for the audience. Parimal, what hemostasis, whenever you wanted to do, did you ever tie in with your passion of new things? Did you ever try in the PCNL coagulation? One person has kept, he tried with bipolar hook,
Yes.
monopolar hook. Everybody has this idea that I want to stop the bleeding, but in kidney parenchyma usually doesn't work out, is the literature. What is your idea in kidney, in bladder, in prostate, when you want to coagulate? What will you do?
Sir, I will not coagulate anything in the kidney. That will be
Anything in the
if it is
kidney.
a partial injury to a vessel. If I try to coagulate that with the laser or water bipolar, there is a risk of weakening that wall of the artery or a vein, whatever, and their chances of pseudoaneurysm increases. That is my theory.
Correct,
It
correct.
differs for others. So I will not coagulate any type of bladder in the
You will
kidney.
not do any coagulation. What about in bladder? Anything you have tried? Bladder and prostate?
Yeah, in bladder enucleation is 0.330 in a TFL in hemostasis mode, or it may be just the same 110 also works in a TFL. It's just a contact mode and it coagulates.
Dheeraj,
Sir, in prostate,
coagulation. You told already that most of your settings will be same, like 30 hertz and 1.5 joules. Do you do any keeping away? Some people said dur rako. I said, what is your method of severe bleeding? I am not saying mucosal bleeding. Some sputter comes and which spoils the vision.
There's a big difference between the Holmium laser and the TFL laser, sir. Holmium laser, what we need to do is we need to defocus the laser and fire the laser because the pulses are so scattered. But in TFL laser, the pulses are so uniform. If you stay direct onto the bleeder and even if you do use the contact mode, non-contact mode, it is going to give a good hemostasis. So same setting.
Yeah,
And
Dheeraj, you have to stay close because the depth of penetration is less. So you have to be very close to the bleeder. And in Holmium, even from far away, the laser will go there and the energy will be lesser.
Yeah, non-contact mode may be close to the bleeder, but contact mode or even non-contact mode, we are able to control the hemostasis.
Yes.
Okay. In the bladder, it will be
so no separate settings, Dheeraj, same settings.
Same settings, sir. But in the newer lasers, there are two settings where you can increase the pulse width. Long pulse you can keep for hemostasis, which will work for beginners.
Long pulse width for dusting and hemostasis. Let us remember like that. Vikram, you have experience in sputter.
For sputter in prostate 135 watts, I use a 15 watt vaporization, 15 watt hemostasis. There are two settings there. So 15 watts will vaporize the tissue and another 15 watts will go for the hemostasis. So I use total of 30 watts for hemostasis in the 135 watt machine.
This is difficult to understand because the prefixed settings are very difficult to understand because unless you change it, we cannot learn. If you even recent Twitter Oliver Traxler says that don't use prefix settings because company should not dictate what you have to use. Let us have the options of manipulating it so that the clinical scenarios may change. Tanuj sir, now you must accept one criticism that in Holmium laser it nicely produces the bubbles, it separates, but by chance one bleeder if you perforate, it is slightly difficult to control for normal person, and somehow you people manage it, but not as good as thulium fiber laser, where anybody who go and touches or nearer to it with whatever joules, it gets sealed off. I have done large, sometimes taking lot of time, but excellent hemostasis will be there with thulium fiber laser. What is your tips and tricks in large bladder in high watt holmium laser?
So, sir, what I have realized over time is it is the frequency which matters more than the energy. Most of the time, just by decreasing the frequency, we are able to coagulate. Sometimes, if a frequency
of reduce, sir.
Reduce, much reduce, maybe 15.
That means 30, 40 to 20 will come?
Yes, up to 20 hertz. And sometimes if the bleeder is still not coming down, say I'm at 1.2 and 20, it is still not settling, I will decrease the energy also to 0.6 or 0.8. And then most of the times we are able to tackle. Only thing that gives trouble is a sinus bleed, which sometimes you may not even realize during enucleation, and after you take out the sheath and you see that blood. And for that, I don't shy away from using a ball electrode if I have to.
Yeah. Very nice answer. Very nice answer for the audience. Excellent. Soundarya, what is your hemostasis?
It's a 30 watt setting, sir. Either 200 hertz and 0.15 joule or 150 hertz and 0.2 joule. Total of 30 watt setting for hemostasis mode.
This is the one setting we are using because hemostasis high frequency and low energy, na Soundarya?
Yes, sir. Slightly higher energy than the other areas we use.
200 frequency and
0.15 joules. Totaling
0.15 joules. So this is one different setting which we are using. But Soundarya, 110 normal thulium fiber laser setting, soft tissue incision, won't it coagulate?
No, for coagulation, we specifically have this hemostasis mode, not the incision mode. So hemostasis mode, either 150 hertz and 0.2 joule, maximum of 30 watts is the maximum available with the hemostasis mode in the 60 watt thulium fiber machine. So 30 watts is the maximum, and we use the maximum.
Pulse width must be very, very long in this.
Yes.
That is why it is coagulating very well.
That is why it's coagulating, and the maximum available with that is 30 watts.
Again, company recommendation. Maximum laser settings in thulium fiber laser, Soundarya knows because 5 years she is associated and she has done a lot of research. This is the one setting I rarely use because 110 will coagulate. If it is really mattering, I will call her, and then that time again I forget that 150 hertz to 200 hertz and 0.15 I am repeatedly forgetting. Anyway, now we will go to the last part, the bladder tumor quickly, and then finish this day for this day. Parimal, bladder tumor, you are doing en bloc with holmium or thulium?
With the thulium TFL, it is 1 joule and 10 hertz.
I am also like that, very comfortable. Dheeraj?
I start with the same setting, sir. I might increase to 1.5 and 10. 1.5 energy and 10 frequency.
So this area you are not using 30 hertz and
only area where I'm not using 30.
Why you changed it?
I want better control, sir. I don't want to create any.
I
want better control.
So bladder tumor needs better control. So you have come to 110. At least one setting you are with us.
Yes.
110. So you came from 30 to 10. Vikram, you might be doing bladder tumor.
Yeah, holmium 12 to 15 frequency, energy 1.
So same 110. Here you also have changed. So everybody is coming to a common area, 110, 112, 120 like that. Tanuj sir?
0.8 and 35 for me, sir.
What, sir?
0.8 and 35. 0.8
so still you are using high frequency. So naturally, because of a larger mission, you are used for high frequency tackling of the tissues. Isn't it, sir?
Yes, sir.
Yeah.
Yes, sir.
You feel that it is helpful in dissection, in faster cutting, everything.
Yes. And still it is not 50 hertz that I'm operating. So I have better control over my depth in the bladder.
Depth and coagulation also.
Yes, sir.
So you are a high frequency player in soft tissues.
So that is the advantage of high power laser.
Advantage of the high mission. And we unfortunately you are the only person who has experienced I think everybody, I mean, just for the audience sake, do you think that your super seniors also uses same high frequency and 1.5 joules, sir, generally?
For
prostate
I
and
use 2 joules and 50 hertz, sir. Most of them.
So most of them use 50 hertz for the prostate. So we don't have 100 watts holmium.
They use full capacity of 100 watt laser.
Parimal, do you have 100 watts holmium? No.
No, sir.
No. Vikram, do you have 100 watts holmium? No. So we don't. Dheeraj has experience, na, previously.
I was doing with 35 watts previously, but I can't do a good job with that.
You and Vamsi favor 35 watts thulium fiber laser and Holmium, but you are very comfortable because you use little bit of mechanical and appropriate areas you incise, and coagulation is also okay. Soundarya, bladder tumor, we are doing lot of cases. You are also experienced.
In incision mode, 10 hertz and 1 joule, sir. And for
Correct.
coagulation, 150 hertz and 0.2 joule. To
Same
coagulate
thing.
the parasitic vessels at the end of at the borders of the tumor.
In the beginning, can you coagulate the base of the stalk with that hemostasis mode, Soundarya? Not necessary, I felt.
Not necessary, but if we see obvious dilated vessels running around the tumor, then we coagulate them initially, then we start incising the mucosa
You
around.
feel that coagulation with this 200 and 0.15 is better than 110?
Yes, definitely better. In the
Definitely
hemostasis
better.
mode, we should use.
That is the one area I am
The two
studying
pedals we
on.
can simultaneously use, sir.
Actually, that is one place where TFL is advantageous, sir.
Yeah.
When you
Most
see
probably.
dilated vessels, you
Yeah.
can
It
coagulate
coagulates
and
very
with
well. I mean,
Holmium, whatever
yeah.
you do, it will split the vessel.
Yes,
and
and
start
causes
bleeding.
more bleeding. This is
Yes.
actually you are accepting with open heart. Otherwise, you are diehard Holmium laser. Do you routinely do en bloc resection of bladder tumor, or you are not a believer of that?
In tumors which are amenable to it, I do it, sir. In the solid tumors, broad-based tumors, I tend to avoid.
Yes, sir.
And anterior tumors still.
2-3 questions are also there. TFL in matrix stone. I think whatever you use, it will not work, is my feeling. Parimal, you are the
Okay, so the TFL works excellent in a matrix stones.
matrix stone.
I have done 4-5 cases of matrix stones, and the energy you need to increase the energy sometimes to 0.6 to 0.8 or a 1, and the frequency of 10 to 15.
Okay. What about Dheeraj?
I use fragmentation mode here, sir, and I feel fans has a great advantage when it comes to matrix stone as well. 1 joule of energy and 10 frequency in fragmentation mode I use. And use fans earlier in the matrix.
Yeah. Vikram, you also experienced in matrix? Same.
Yeah, same upper tract. I would prefer to puncture it rather than to meddle around if it is too big.
I also slightly, after fans came, it is totally different.
Yeah.
But before fans came, I strongly go for PCNL. I was dead against RIRS in matrix because one piece also causes fever, and that causes fever in the post-op is a big problem. For that one piece going again in with fever, oh my God, it is difficult, is my feeling. Tanuj, sir?
Yeah, RIRS for matrix is, unless you are patient enough to pull out all those pieces or use the fans, it is very disturbing, and you break and it'll again form that cloud sort of thing, or you'll see that ball all the time.
What about Soundarya?
Yes, sir. So in the presence of fans, it's good to go ahead with RIRS. But even in the presence of fans, whatever laser settings we used, we have to use multiple times basketing, because even with fans, sometimes the large matrix cannot be sucked out. So we have to use basketing. So I would rather prefer a PCNL in case of matrix stone.
Yes.
This
Now,
patient
let's,
matrix have a little bit more of mucosal bleeding also, sir.
Yeah, sure. Inflammation will be there, and definitely limited place. I mean, it does well when you have control. Fans, once you know suction value, then it's a different issue. Now, to conclude, please give one point which you should not do. In your gut feeling, what should not be done, you give message. Then we will conclude quickly. Parimal, in the laser missions, what you don't recommend? Seriously, you don't recommend these things. What you don't recommend?
Do not exceed any given point of time, that frequency that you cannot control. And second thing, the maximum energy should not be go beyond 20.
In stone.
In stone, nothing beyond 20.
Okay. Dheeraj, anything related to soft tissue or anything? No, which should not be done.
Stone, I forgot to mention one point. It's a large stone. Don't try to fragment too early, because you can reduce the stone bulk in the first setting, and you can always take it to the second setting and do the pop dusting, whatever in the second setting.
Correct. I agree that. I also feel, I agree means that. Vikram, what do you say? What you don't want to?
I would definitely recommend against using TFL in ureter, especially for the beginners.
Yes.
If I have to give one advice, I would say please avoid TFL in ureter. Once you gain experience, then they can use. Liberally use pneumatic lithotripter in ureter. More safer. Holmium is safer.
Very good. Next, Tanuj sir.
Sir, I would say what Dr. Vikram sir has said. be fearful of that impacted upper ureteric stone or the
Yes,
ureteric
yes.
stone. You have to be well trained before you use laser in ureter. Talk to experts, learn how to do it and what are the settings. Otherwise, you always use pneumatic only, because that is the biggest problem that all of us are facing now with the strictures and all. So be very careful in ureter. That's the only stone you have to be fearful of.
Soundarya.
So in the kidney stone, do not exceed 20 watts. In the ureter, do not exceed 10 watts. And even sometimes if we do not exceed 10 watts, because of the long time if we use laser, the temperature of the irrigation fluid can go high, and not just the laser fiber touching the ureteric mucosa as such, but even the hot irrigation effluent can also cause ureteric damage. Therefore, avoid using laser for a long time in the ureter. Preferably use pneumatic, or do not use laser. If at all, use less than 10 watt settings.
Correct.
Can I
So-
just add there, sir? If we are
Yes,
doing
sir.
ureteroscopy, it's important to independently open that other channel and vacate that fluid.
Yeah,
Or
yeah.
come
Yes,
a
sir.
little bit more distally.
If the outflow is not there, it is disaster. I know that.
Hmm.
I had a stricture in the third case, long
Yes.
segment stricture for large stone. It's purely my mistake by using TFL. That is very early stage. It's not correct. That's why in the beginning, at least, you should not use. I also agree. Last question asked is a relevant question. We cannot avoid this. Lot of people daily, one junior asks, sir, what laser to buy only for stone, both stone for prostate? Don't explain, give your opinion. Parimal, only stone, what will you buy? Both stone and prostate, what will you buy?
For only stone, I would recommend it Holmium 35 watt. to
Okay.
start.
For prostate and stone, if you want to buy?
Then TFL 60 watt.
Yeah. Dheeraj?
Sir, if you want to start a good enucleation program, you have to buy 60 watt to reduce the learning curve. If you already had a 35 watt, you should start do enucleation with the 35 watt as well.
Vikram?
35 watt quanta for stone, Holmium, and again, it depends on the mentorship. If you are getting trained under Holeup, then one machine for 100 watt, like what Tanuj is using, will do for prostate and stone. But if you are getting trained under me, probably then I will prefer to use a TFL. Then I will recommend a 60 watt.
Okay.
IPG.
Tanuj, sir, stone and prostate. Stone separate, both stone and prostate. Because money is also constrained, but your opinion.
I know, sir. Again, as most have recommended, probably a 35 watt Holmium for only stone.
Yes, sir.
And for stone and prostate, one can go for either 60 watt Holmium or 60 watt TFL.
Yeah, very good answer. Soundarya, what you will recommend for stone alone and stone plus prostate?
Only stone, 35 watts Holmium laser.
Yes.
Both stone and prostate, 60 watt thulium fiber laser.
Cost effective, you mean to say.
Cost effective.
Cost effective. Thank you very much. And it is a long session, 1.5 hours. Total audience is about 200 and very useful. They will see all this most of the people see tonight and tomorrow, and they will keep their own this thing. But most of the areas we have consensus that utilize, frequency and settings. Not a very confusing subject. Fine, acceptable. Everybody will have little bit of setting variation, but I hope it will serve the purpose for the juniors. Thank you once again.
Can I
Yes, sir. Yes, sir. Please start.
Point bottom line that we need to be mindful about the maximum setting that we can use. What Dr. Soundarya said, 10 watts in ureter, very much we have to follow that. 20 watts in kidney, 30 watts maximum in PCNL.
Yes.
These things we have to keep in mind, and we have to understand the man has to merge with the machine. Every
Yes.
machine is different. Whatever machine you get, you have to change the settings and see what works best for you. That's why all of us have different set of settings, but all of us are able to give a satisfying result to our patients.
Correct. So thank you, sir. We will conclude here. Thank you very much.
Thank you, sir.
Thank you. Thank you, sir.
Thank you very much for your